Hello guys, I'm Dr. Mithun. I'm a critical care doctor. So we'll talk about kidney today. Your kidneys work 24 into 7. It filter blood, remove toxins, maintain the fluid balance. But what if they start to fail and you don't even feel it? The foamy urine is just dehydration, or is it a sign of kidney disease? A normal creatinine level, does it mean that an elderly patient has strong kidneys? In this video, we'll break down how doctors estimate kidney health, from simple markers to advanced markers, and the truth about creatinine and even race. Because by the time symptoms show up, it might be too late. Stay tuned, it might just help you or someone you love catch kidney disease before it gets too late. So let's go into the video. So we'll start with a story. This incident was told to me by nephrology resident. Patient was a bodybuilder. He used to work out frequently. He was an athlete too. He used to run kilometers and kilometers, and he used to consume all the protein supplements and creatine also on a regular basis. So what happened was, he was passing urine. When it hits the toilet, it was getting foamy. He googled, he saw that foamy urine can be a early sign of kidney disease. It can be proteinuria. So he got confused. Since he's a fitness freak, he came to the nephrology OPD with this complaint. So we can see how doctors estimate kidney health and what are the markers for kidney health. First one that we do is, the basic one is blood urea nitrogen and creatinine. So blood urea nitrogen is not a specific marker. It is less specific than creatinine. So it can be increased in case of GA bleeding, high protein intake, dehydration. So it's not a specific marker. And about creatinine, it depends upon many factors. It depends upon age, sex, race, muscle mass, even gender also. So it is also not a specific marker. A single marker doesn't tell you that the patient has a kidney disease. Either you have to combine different markers, or you have to go for the coming trend of a single marker. If the single marker has a rising trend in the future, it can suggest a kidney disease. When we come back to creatinine, I told you creatinine depends upon many factors. So in case of age, elderly patients will have reduced creatinine because they have reduced muscle mass. When you come to females, the creatinine levels can be less because they have reduced muscle mass compared to males. People who works out regularly, bodybuilders, people who have increased muscle mass, they can have increased creatinine. Because of increased muscle breakdown, the waste product can be more, so they can have increased creatinine levels. Also, people who take protein supplements and people who take creatine, they can have increased creatinine levels. Doesn't mean patient has kidney disease. And also, black people compared to the whites, they have increased creatinine levels because they have higher muscle mass compared to the whites. Then we estimate the glomerular filtration rate. It depends upon serum creatinine, age and race. There are many equations available, so I will give you the gold standard equation on the screen. Another one is creatinine clearance. It is used in drug dosing. It is less accurate than eGFR, but still widely used in pharmacology. Equation for the same is given on the screen. You can measure whether the patient is hypertensive or not. If the BP is on the higher side in young individuals, you can suspect something like renal artery stenosis or polycystic kidney disease. Again, hypertension can lead to hypertensive nephrosclerosis. Diabetes can also lead to diabetic nephropathy. So you can check the sugar levels and BP of the patient. Then you measure the 24 hours urine proteins. And also albumin to creatinine ratio. So normally, the glomerular filtration barrier prevents the proteins from getting leaked into the urine. But when they get damaged, you can see protein in the urine. Protein in the urine can be an early sign of kidney disease. So if you are getting misleading creatinine values and kidney function is getting worse and he is not passing urine, you can go for an ultrasound of kidney, ureter and bladder to see for any abnormalities in the kidney, like any cyst, any scars in the kidney, or the kidneys are shrunken, which may be seen in chronic kidney disease. You can also look for any post-renal causes of kidney injury, like kidney stones or ureteric blockage, prostatic hypertrophy and all that. If we suspect any structural abnormality, we can go for CT or MRI to look for other higher causes. If the diagnosis is unclear, we can go for kidney biopsy as well. These will be done in later stages. When the diagnosis is unclear and the other values, other markers of kidney are misleading. Yeah, there is another marker, serum Cystatin C, which can be measured. It is normally not measured because it is not easily available and it is comparatively expensive than serum creatinine. Cystatin C is that it doesn't depend upon the muscle mass. It gives a more accurate measurement of the kidney function than creatinine. Coming back to the patient, so why does the urine form? The urine normally forms when it hits the toilet because of turbulence. But if the forming is persistent and if the form is not getting dissipated after some time, it can be a sign of proteinuria. Proteinuria can be a sign of early kidney disease. So these are the checkups that we do when a patient with suspected kidney dysfunction come to the OPD. Your kidneys may be silent, but that silence doesn't mean they are safe. Catching kidney disease early is the difference between a lifelong health and a lifelong machine. So don't wait for symptoms. Know your numbers, understand your test. Ask your doctor what is my eGFR, not just my creatinine. Your kidneys take care of you every second of the day. Maybe it's time you take care of them too. If you found this video helpful, like it, share it with someone who might need it, and don't forget to subscribe this channel for more real, reliable medical insights. Until next time, stay curious, stay healthy.